Very warm welcome to welcome you to this session. I am very pleased, I'm honored to be here. I'm also very pleased and very honored to be given the chance of moderating this session. My name is Allam, in Arabic, Allam al-Nur Osman Ahmed. In English, Allam Ahmed. Even my dad, he said to me, who is this Ahmed? You should use my name. I said to him, in England, they use the surname, so I can't. So my name is Allam Ahmed. I work at Queen Mary, University of London. My area of expertise is knowledge management and sustainable development. I hopefully will be, inshallah, I will be able to moderate this within the time. We have 1.5 hours for the first set of presentation. I think the best way to do it is to give every presenter 10 minutes to make his or her presentation. And then after we finish, we bring all the speakers here, and then we ask them questions. But what I would like to ask, if you have any question from all of the presenters, please write it down and keep it with you. And once we finish, we bring all the speakers here, and then we can ask them. You can say my question is specifically to Dr. or Professor X, Y, Z. Or if it is a general question, we will take it. But I would like to urge all the speakers to make sure they can, when it comes to 8 minutes, I will remind you, okay? I will sit here rather than I am sitting here. But when it comes to 8 minutes, I would remind you if I see you not coming closer to your conclusion. At that time, I kindly ask you to try to think of how to conclude within the next 2 minutes. Because the very important thing, I think, if nicely you started, you should finish it nicely rather than you will be cut off by me or other person. So I think if you're all happy, Dr. Maha is here. Okay, Assalamu alaikum. So let me welcome our first speaker. She's from University of Prince Mugrin in Medina Munawwara. Dr. Maha Mudassir Hassan is currently an assistant manager for scientific research and graduate studies department and associate professor at the Civil Engineering Department, College of Engineering, University of Prince Mugrin. Her main research interests lie in the steel structure in addition to inspection and rehabilitation of historic masonry structure. Oh, this is very interesting. So the title of her talk will be Shortage of Healthcare Facilities During COVID-19 Pandemic Outbreak. Excellent. So the floor is yours, Professor. And I think they gave you, or there is a monitor here. At 8 minutes, I will just show you if I see you not coming close to the conclusion. If you can all join me to welcome her, I think in the normal way. Thank you very much.
Okay. Thank you for this introduction, Dr. Alam, and good morning. So this is Mahmoud Dasser from University of Prince Migrin. And first I would like to thank the forum sponsors, and let's dive in. Okay, so when we think of humanitarian efforts, the first specializations that comes to mind are medical and legal ones. However, if you think of the infrastructure and required facilities, this falls under civil engineering, which is my specialization. So today in this presentation, I will be discussing the shortage of healthcare facilities during COVID-19 pandemic from an engineering perspective. Starting with the outline, I will discuss first the shortage of healthcare facilities and then move to challenges facing building of new healthcare facilities during pandemics, and then how pandemics influence the construction industry, and finally conclusions. So first, considering shortage of healthcare facilities, we all saw the news of overflowing of hospitals with patients during the last pandemic, and many news were shared considering patients not finding a place to be admitted to. And we saw this in both developed and less developed countries. So the measures that both countries took was to either build new facilities or to convert non-medical facilities into healthcare facilities. And when we look at building new healthcare facilities, you will find that we have many constraints regarding the tight budget, and also we need to make a timely decision related to the used structural system, the location of the new healthcare facility, the bed capacity, and the construction cost and duration. So we need to consider parameters related to the life cycle costs. If you look at converting non-medical facility into a healthcare facility, we have to consider also the tight budget, and we need to make decisions related to the potential non-medical facility to be converted, also the location of the facilities, and the collective bed capacity, and the conversion cost and duration. So how to make a decision in a limited time? This is a challenge that we need to consider. We saw many cases of conversion of non-medical healthcare facilities. So you can see here, we have a stadium that was converted into a temporary healthcare facility, and this was made in many countries. These examples are from Canada and US. Also, there was the famous hospital that was built in China, and this hospital was built in 10 days with over 10,000 construction workers working in shifts in order to accelerate the construction process. So what are the challenges that we face when building new healthcare facilities? We have the complexity of operational requirements, and also we need to accommodate expensive equipment in tight spaces, and also we need to make sure that the ventilation system is safe in order to make sure that an infectious disease will not be spreading through the air. So when we look at the construction of a new healthcare facility, we need to first identify a potential construction site. We need then to perform geotechnical and site investigation, determine the capacity and perform the architectural design, and then determine the design and cost estimation of different items. And when we look at the structural system, we have raw material costs, construction costs, consultation costs, labor wages, and also equipment rent and mobilization, in addition to indirect costs. So when we look at the pandemics and the construction industry, we need to make a decision related to the suitable structural system in a really tight time. If we look at the optimum structural systems that can be used for hospitals, we have to consider many factors. First of all, we have some available resources, which means what is the available construction materials in each country. Also, we need to consider the construction cost and speed, the function and shape of building, and we have also some environmental and sustainable constraints. So in our research, we defined a set of competing structural systems, including conventional RC skeleton. We will see this in the next slide in details. And also we defined construction methods, including cast in situ, assembly on site, segmental construction, in addition to merging between assembly on site and cast in situ. And for each competing structural system and construction method, we perform a detailed analysis in order to estimate the construction time and cost required. So these are examples of the competing structural systems that we took in our decision. The conventional reinforced concrete skeleton, steel moment resisting frame, modular light steel building in which we use really light sections, and we have steel container modules. These are really simple. We take the containers and then we convert them into buildings, and then we have precast concrete and composite steel concrete skeleton. For each competing structural system, we define the pros and cons. And for example, the conventional reinforced concrete skeletons, this is a very common construction material in our area. It's have a really low cost, but it has some cons related to being heavy, and it requires a very long construction time. So our aim in this study was to find numbers like these to get the average cost per square area for hospitals suitable for our area, and to define a clear path for the construction work, starting from the raw material extraction until we finalize the new healthcare facility. And finally, moving to conclusions, as we can see, COVID-19 pandemic has affected many economic and humanitarian aspects, considering labor-intensive industries, and construction industry was one of the industries that was heavily affected by the pandemic. And the overflow of existing healthcare facilities with patients required construction of new ones. Engineers had to think of methods to accommodate this requirement in a limited time while considering the tight budget. So in our research, we examined optimum structural systems that can be used to build a permanent healthcare facility in the shortest amount of time while staying within a budget. And this research is part of an overall research to design a decision support system in which we can provide recommendations for the structural systems, the construction method, and the location of the new healthcare facility in a timely manner. So thank you for listening to this presentation, and I am looking forward to your questions.
This is really, she should be applauded really, because 8 minutes is wonderful for academic to finish really, and it's well presented, and it's very. Because of that, your reward, we can give you a question now. So you can, if anyone want to ask a question now, burning questions, because she done very well in 8 minutes. So she got 2 minutes to use to add more if she likes. Anyone would like to ask a question? Yes, Professor. Professor Khalid, Fadl.
Thank you, Dr. Marcus. Now this is for the immediate response for the...
Can you all hear him, okay?
Can you hear me?
Okay, sorry.
Thank you, Doctor, for this excellent presentation. This is for the preparedness for the immediate response. Will you consider the usability and the relevancy of the solution after the crisis as a factor that determine which choice that you are going to select?
Okay, so what we were thinking of is that during the pandemic we saw many late responses, and there was some delays in dealing with the overflowing of hospitals with patients. So what we thought of is to be prepared for upcoming pandemics and even for earthquakes. Even in the last earthquake, there is currently a problem with the survivors. They are not finding a place to stay. So we are thinking of finding an optimum structural system with the lowest cost. Instead of staying within tents, which is not reasonable considering the freezing weather, we can have a structural system that is not costing much, and at the same time it's suitable for people to use. So this is what we are thinking. It's not only for the pandemics, we can use it for any disaster.
Thank you very much. Any one last question? No? Any other question? Yeah, go.
recommendations, the best actions of these we can adopt to help the humanitarian aid in a crisis. في الكوارث مثلا ازاي نستفيد من الابروتشز دي تساعد الكوارث في الازمات، لكن دي مش في الازمات دي كوفيد. absolutely that's a very good example. بس في الحاجات الكوارث اللي بتكون الاكشنز very quick and very in the moment، ايه الاحسن approach to adopt it من دول؟
what we are considering is that we will be prepared if a disaster will come. So for example, if a pandemic happens next year, we will have now a decision support system reasonable and designed for each city in order for the decision makers to be able to take a decision during the pandemic directly. So this is to be prepared for any disaster. And actually I was interested in this conference because when we started this research we faced some lack of information related to the available healthcare facilities, the number of or the capacity of beds, things like this. So we wanted to take a perspective from another side.
Absolutely.
In order to take all the factors in our study.
Absolutely.
Thank you
very much, Victoria. Thank you very much. This is very good start. Thank you very much. Technical advice, please don't touch this mic because it will, so it's not, don't touch it. Okay. Now, thank you very much, Victoria. Now we're going to move to the second paper, also another exciting title, exciting two distinguished researchers. We're going to listen to a paper. The title of the paper is Developing a Humanitarian Logistic Framework Using Reinforcement Learning Techniques. Very good. I like this title. Now, this is going to be presented by two distinguished academics from Al Ma'rifah University. The first one, Dr. Khalid, Al-Gumedi is currently an advisor to the president of Al-Ma'rifa University and dean of College of Medicine. He is highly experienced healthcare executive leader in Saudi Arabia. He is a board member of several academic and national cluster boards. He was the national model of care lead, contributing to strategy design. His co-author is Professor Ashid Komar Dota. He's a professor in the Department of Computer Science and Information System at Al-Ma'rifa University. His specialization is in the fields of artificial intelligence and cybersecurity. According to the Stanford ranking, he's among the top 2. Oh, we have a top 2. This is you, Professor, right? Yeah. Well done. We have to congratulate him. Really well done. Because this is a top ranking of impact, really. Well done. The top 2% of scientists in the world. He received Best Researchers Award by the Nature Science Foundation. So this is quite a lot of. We're going to hear the floor is yours, Professor.
Thank you.
By 8 minutes, I will remind you. Hopefully, I will not move.
Inshallah. But I will not be as fast as Dr.
Yeah, no.
Good morning, everyone. In fact, as Prof. Allam mentioned, that the aim of the study is to develop a humanitarian logistic framework that help in allocation of the resources by using reinforcement learning technique. In the landscape of the human logistics, we have a lot of challenges entailed by the nature of the humanitarian aids, the context that they happen. But when we talk about human logistics, we're talking about delivering the right materials at the right place and the right time for the beneficiary. And unfortunately, most of the disaster happen suddenly. So there is no much plan prepared. I mean, even in the pandemics, we can predict the modeling. But in a case like earthquake, it's all of a sudden like that one. So the preparedness of the country, of the site, of the logistic is not there. So you have to have a prompt response to minimize the catastrophe. And also, because of the huge complexity of the situation, the coordination is very critical. Yesterday we talked about the allocated resource. So we already have scarce resources in a very dramatic situation to optimize the delivery of the resources to the beneficiary in the right time. We have to have an efficient way to monitor that and make sure that the victims will have the right shelter, the right food and water and medication, plus according to the nature of the disaster. In any situation, of course, there is a need assessment. And after the need assessment, we will have the plan. Then we will mobilize the resource. And after the mobilization, we will implement it, whether distribution or having the shelters or whatever. Then we will evaluate. That, if we want to monitor it by human factor only, it will take time, especially with the complexity of the data and the lack of the accuracy and validity of the data coming from the field to inform that decision. So we need to have some sort of support to optimize that process. What are the problems that the research is focusing on? What are the area of that? We have a risk and uncertainty that comes with the disaster. And also we have the aftermath. There is a problem in the disruption of all the logistics enablers, roads, trains, etc. And even the energy as an aid for the technology and the new adaptive modeling for delivery is also there, adding to the challenge. And people, due to these unfair distribution or unoptimized distribution, usually they feel that there is unfair distribution of resources. And we've seen in this problem, people in Syria, for example, they are suffering a lot and more compared to the people in Turkey. And most of these problems are coming from logistics, irrespective of what are the reasons for that logistical problems, but there are problems. And having multiple sites definitely will lead to a very dedicated management plan to manage the resource allocation. What are the adopted techniques so far? Usually it's either by modeling or optimization and simulation. So we model the scenario, we try to optimize it and simulate. And then we generate the information according to that. Or there is a heuristic solution approach that gives a solution for the expected challenges. However, this heuristic solution doesn't deal well with the complexity. So optimize the solution according to the complexity, we need another level of management. So what was the research objectives? And I will invite my colleague, Prof. Ashit, to continue on that. We are basically answering two problems. How can we optimize the resource allocation, and how can we improve the transportation? Prof. Ashit.
Thank you, Dr. Khalid, for your nice presentation. Now I will discuss after that what is the research objective. In this, we have two important issues regarding the research objective. One is the optimal research allocations. What is the resources that is available with us? How we can optimize it that it should be reached to every victims. A second one is the regeneration of the optimized path. So when new transportation is there, we must be follow the path through which we can reach to the victims. Also, these two things we have to, our main objective is here. Also, this objective also satisfy if there is a earthquake is now in Syria and Turkey, our proposed framework will support them about to deliver the different materials to the victims. Also, it will generate the path. It will generate the shortest path or optimized path. If and you have the real time of the data, GPS data with us, then we can support them with the optimal facility. So different authors have proposed different time about this framework. The first author, the study 6, he proposed about the Dr. Khalid Assay, the UAV. Author 7, 8 also proposed some method. But our method is that you are using the aerial vehicle routing problems. So research methodology. What is the research methodology is associated with that? First thing, we have to identify the complexity. What is the complexity of the resource allocations? Means the resource, it will be allocated optimally. Second thing is that reducing the complexity using the proposed reinforcement learning approach. Here we are using two approaches. One is the reinforcement. It is consist of two parts. You are doing with the help of the SARSA algorithm. There is one algorithm and double Q learning algorithm. So here SARSA algorithm will be help us to find out the optimal path to the optimal resources, and double Q learning algorithm, it will be help us to find out the optimal path. So all has been tested by Python programming, and we got the very beautiful result out of that. We can see it, the proposed algorithm and already existing algorithm. So finally, we have to evaluate our framework. The framework that already we have, we evaluate it with the different proposed framework, and we found that our proposed framework is much more better than the existing one with the help of the different parameters. So here the research methodology, we have a resource center, and we have the different disaster locations, 1, 2, 3, and we have the two criteria, actions and the reward. Actions, if there is implementation is good, we will give some reward. If the reward implementation, it is satisfy all the criteria, then it will be assigned the good reward. If not, then again we will follow the beginning of the step in order to get the best reward. So it will follow the heuristic approach that Dr. Khalid said. It will start from the state transaction, and each state transaction have a decision, and each decision have again the state transition until we reach to the goal, until we reach the optimal path and the optimal allocations. We will follow all the stuff recurrently until we reach to the optimal one. Now, result discussion, we have the three proposed, three existing framework. One is the EU et al. 2021, EU et al. 2019, and the COW 2018. We have the framework, and we analyze our proposed framework with these three. So here we take the principle of the proximity. We have here we take the three parameter, the NUT. We have three parameter NUT. N is for the disaster location, U is the for the allocation, and T is the time. We will see how it is differ. First one will be keep the U set to 1, and all the 2 will be variable, and finally you will take another, all the 3 will be the 3 variables. That will be see how it is work. But it will be for our experiment, it is working for the small scale instances, and we can go for the larger instances if it will the system will be supporting. That already here we will take the three things. NUT, as I told you already we discussed, N is the number of the resource, and U is the number of the resource, N is the number of disaster location, N is the resource, and T is the time. So according to that, we and time is the 2C. We take the constant. Maybe time will be vary from the time, from the hour, second to the minute. So the evidence, the proposed framework achieve superior outcome. So our proposed framework will be see how it is achieved the superior than the other existing framework. Now here it is very important that how you draw your conclusion about that. We have that instances. We have the 3 instances. NUT, first one 214. We have taken 214 the resource and the allocation and the time, and the stage size it will be increased dramatically according to the allocation of the disaster location, that is the N. Now we saw here the U et al. 21, we get the objective value, also the time in the second. Also in the U et al. 2019 we get the objective value and the time, and COW also that is objective value and time. In our proposed framework, we got our objective value is lesser. This is already tested in the system, and using the Python programming and the Windows environment. And our proposed framework, the objective value is much more less than all the existing framework, and also time is less. What is the objective value? Objective value, it will give the allocations and the shortest path. So it is less, and also the time. What is the time indicate? The time indicate it will be go from the source to the destination. So we take the different instances and we calculate our framework, and the framework objective value and the time is much more less than the existing one. So we draw the graph here also regarding this. We can see about the different instances 216, 516, 518. We go to the 518 and we can check that our time is much more less than the other 3. We go for the U et 21, U et 19, COW, and the proposed framework. We can see 153 here for the U et al. And 102 for the U et al. 2009, and cow 125, and finally the proposed framework 112. So time is less on that. So result and discussion, here we are following the two algorithms. One is the SARSA algorithm and another is the double Q algorithm to optimize the path along with the optimize the resources. Here, here we are now. It was before it was fixed the U. Now everything is very here. 214. The annuity, number of the resources, allocation, also the time. All three varies. Also, when all three varies, we compare all the results and we find out our proposed framework. It will be give the best objective value, best allocation, and the optimal path. Also, it will be give the time in the second and to reach from the source to the destination, and the time it will vary. We take the small experiment, so the time is coming in the second. If you got the large amount of the data, maybe it will be hour or maybe it is the minute. Similarly, yes, I draw the conclusion. Okay, Dr. Alam said the time is over. Okay, and now here we are following the reinforcement algorithm, and you are we are implementing this about the Q learning, double Q learning algorithm and SARSA. The third one is you adjusting the parameter, that is the NUT, and first one you fix the U and you analyze our proposed framework and we find it is the best than the existing one. After that we vary all the three parameters and we found with that our proposed framework is better than the existing one. And here, based on the data, the SARSA algorithm is superior to the dynamic programming approach in terms of the processing speed. Our speed also is less, as we saw in the graph. Also, the final objective value is also less. So we think that our proposed framework is far more better than the existing one, and we try to implement on the real life situation. In Saudi Arabia, anywhere if we have the data, like the real-time data, DPS data, we can implement very accurately with the optimal path and optimal resources. Thank you so much.
Now we're going to move to a third paper, and this third paper is going to be about the role of sustainable transportation in humanitarian development. And it will be delivered to us by Professor Wafa Saleh, who is a chartered engineer with over 30 years experience in teaching, research, and curriculum design and delivery. Currently, Professor Wafa Saleh is a visiting professor at the newly established College of Engineering at Prince Noura University in Riyadh. She is involved in setting up the research center and looking after the research activities, upstaging the research activities. So, Professor Wafa, the floor is yours. And I will remind you when it close to.
Thank you. Thank you. Good morning. Well, I'm not included in the list of photos there. And apologies for something went wrong with the template. I don't know what happened. Where is Dr. Logina? Anyway.
It's okay. We can see.
I'm sure. Yeah, we'll be fine. So, yeah, good morning, and I think I've got a very simple message I would like to deliver today, and I think we've discussed some of it, or partly we discussed it yesterday again. Humanitarian aid is a new area for me, to be honest, and I enjoyed every bit of what I heard, and I learned quite a lot. But surely, transportation work, and I came yesterday in the session of research and the relevance of research to humanitarian aids. Surely transportation is very relevant, and the previous paper we talked about the logistics and how important that is in delivering the humanitarian aid. I'll see if I can move this. This is the introduction. So as you can see, the template is upside down, but it's fine. Transportation is very relevant. We do a lot of work in transportation engineering to deliver sustainability and to guarantee sustainability. Now, when we look at humanitarian aid, logistics is one very important component. And as the previous speaker said, humanitarian aids are always delivered at a rush, and there is no time to plan. There is no time to prepare things. There is no time to see what is the situation, what's the best options for this situation. And that's very important and very relevant to us. Transport engineers have worked hard to facilitate the transportation network, to reduce delay, to minimize travel time, and all of that is relevant to humanitarian aid. Also, we work a lot in environmental engineering to reduce damage, to improve safety, to improve or reduce risks, and all of that, again, relevant here in humanitarian aid. There are many challenges in many areas when it comes to humanitarian aid, and we can, and research and transportation engineers can help in and can contribute to. The level of service, we do a lot of work to improve the level of service to attract people to use public transportation and rather than using the cars. So we have worked to overcome challenges and encouragement of people to do things. So all of this work is relevant for humanitarian aid and also can help in them. Now the main issue which I raised yesterday is that for each humanitarian aid project, there is a huge amount of data available out there, free. We struggle all the time to get data and to buy data or simulate data. Like the previous paper, you've done some simulation to acquire data to run your models, which I have a question for, but I will ask you later. But the data is very valuable. And yesterday, your minister has donated $45 million to aid 8 humanitarian aid projects. Each of these projects will have a huge amount of data, very valuable. يعني أنا عايزة أقولها كمان بالعربي عشان أمس someone said أنا مش فاهم أنت بتقولي إيه. يعني كل الداتا دي الانفورميشن صح الداتا هي برضو كلها ممكن تكون available for us, we acquire it, ناخدها. ليه بس pay the money and don't get the data? It's a good opportunity to acquire this data and take it, analyze it, simulate it, do decision support system, and do lots of models which will be available out there. When a disaster happens, just grab this most appropriate framework or plan A, plan B strategy, and adapt it there. Rather than when the disaster happens, we collect whatever we can information and quickly نعملها, and then نروح نعمل plan at a rush, and ما مش حدش عارف احنا بنعمل ايه. فالمسج اللي عايز بقولها today in my presentation بالعربي وبالإنجليزي بكل حاجة, make sure to get these data, at least for the projects which you donate money for. It's a help also for the humanitarian aid agencies. They will welcome you because they will see in there an opportunity. They will see a help possible. And then do research, do investigations parallel to, along the side of the humanitarian aid. And step by step, we will have opportunity and lots of knowledge to interfere appropriately, excuse me please, when a disaster happens. Areas which would be relevant also to humanitarian aid, road accidents. When we have a crisis site, there will be lots of accidents and risks and environmental pollution and level of service, deteriorated level of service. All of these are relevant. But the ironical thing is that all of these areas being killed investigations. We have lots of knowledge and investigations and tools and models and strategies to overcome these areas, and we can contribute. So these are some examples of relevant sustainability. Not only this, but behavioral studies. You've mentioned earlier that the victims, also we need to treat them with dignity and give them opportunities. We can do behavioral studies to understand how they are perceiving what's happening to them and what's going on and with them, and how can we help them to overcome their disasters and contribute to their community, even in the shelters and in the refugees camps. We can make them, human resources like this is very valuable. We can make use of them and make them feel that they are valuable. Improve their walking facilities, safety, waiting facilities. There are lots of opportunities there, and each of these areas I've done research in. And not only me, but lots of people. There's a lot of research out there, and it's all valid and valuable and useful, and very useful for disasters and for affected people. At the start of the 21st century, humanity is facing the formidable challenges of securing basic quality of life for a huge number of peoples. Actually, at the refugees sites, there's lots of cases people commit suicide and lose hope and lower their, not standards of life, but their expectations of life. And that we can interfere and prevent and help in managing and improving. Opportunities, humanitarian aid projects, along with the humanitarian aids and donations, I think there should be projects, investigations, making use of the resources paid. I'm not saying monitoring, but as I said, the humanitarian organization will welcome this interference, this support, because it will be in their benefit. Encourage the community itself to assess and identify the good practice and the not so good practice. Involve the community. Monitoring and assessing the case in terms of causes, data availability, as I said, implications, challenges, lessons to learn, and forecasting. There is no auditing for, as far as I know, to any humanitarian aid project or work. Auditing is one very important monitoring system. We need it for all our projects, for road projects and safety projects and national health projects, and for food and for humanitarian as well. Auditing from within the humanitarian aid organizations to assess what they're doing and how good or not so good they've done, but also for the future, to assess what could be done in the future. So I've said internal and external assessment, auditing, documentations, assessment, and protection. Protection, that's what we do to improve the transportation network, to improve the health sector, to improve the environmental sectors. We need to do protections also, so we could protect and prevent. And the previous paper was along these lines, doing predictions as well for the network, but using simulation data. So now we are proposing to encourage us to use real data. So we need more planning to achieve efficiency. Integration of the community, of the affected community with us. Learn from other experiences, learn from other disasters happened, and document these experiences. Involve the community in planning, in finding solutions, in serving the community, because the affected population will know what they need. Get them involved in the design of the shelters, in the type of food they need in one situation. Then we can use that to provide more efficient help in the next situation. Engage the community in the process. And shukran.
Thank you very much, Professor Wafa. And I think roads, very important aspects. I mean, the World Bank, I can't remember the year, I don't know now, she knows better than me. In one of their reports, they said roads in all developing countries, entire Africa, Middle East, all of them. That's what they said. It's not my claim. They said they are not adequate enough to allow international trade to be facilitated. They were talking about international trade. So because you need roads for transportation, for trade. So they said all of them, all of the developing countries, roads are not adequate enough. So maybe one of the recommendations of this, maybe we can provide it to Dr. Luyen and those from the center. One of the recommendations is that because the World Bank said all the roads are not good enough for trade, that means they are not good enough for humanitarian use and so on. Maybe before these roads are collapsing, maybe we can add, they will say it's better now, the planning, permission, and so on, to make sure road. I think what Dr. Wafa was saying is very important. And I remember when Emirates established a nuclear agency, the first thing they did is, I remember I contributed to this long time ago in Abu Dhabi, lessons learned from previous projects. Lessons learned from previous projects. And I think maybe the center, one of the recommendations I think is strongly important, they should establish a knowledge management system where they can document all these projects and create a lessons learned for countries to read these lessons learned before the disaster happened. And this we have done in the UK. My colleagues in Brighton, they did something called, could it have been here, for the police. So the police say in Riyadh, they will read about the lessons learned in Manchester. And they train themselves, if a crime like this happened here in Edinburgh, can I learn from what happened in Manchester? So they call it Learning Lessons Bulletin. So I think this is a strong recommendation. I will send it to the center. They should create something called Lessons Learned Bulletin. The projects that are currently, the 50 million yesterday being donated, why not we learn lessons from this project before they happen again? Now, we move to another exciting paper, from learning to adaptive programming and management. And this is the experience of King Salman, which I'm very pleased to welcome Dr. Muhammad Milad al-Mustafa. Very nice name, Professor. I really like the name.
Thank you very much.
Currently works as consultant at the Monitoring and Evaluation Department of King Salman Relief Center, which is our host. He has 33 years experience across all phases of program development, research, monitoring, evaluation, and knowledge management. Excellent. So he got very strong experience in this. He has contributed significantly to international literature on sustainable development, natural resources management, climate change adaptation, and disaster risk reduction. So the floor is yours, Professor. You have 15 minutes. At 12:13, I will remind you. Hopefully you will finish.
Thank you very much. Thank you so much. Okay, Dr. Wafa, and I think the issues that you raised, all these issues already, I'm just going to highlight here. Thank you very much, and I would like to welcome you all to my presentation, From Learning to Adaptive Programming and Management, Case Relief's Experience. Actually, the time is very short, so I have to start directly without giving any just to welcoming you. How I'm just going to present it, actually I have divided it into 6 sections. First, I will just setting the scene. I will give some background information about the research and about the issue itself, then objective of the research, methodology, findings, conclusions, and recommendations. Let me straight away go to the setting the scene. Actually, before I just start, I need to know what we mean by learning, because you already mentioned about the learning, and she also mentioned about this. And this is not actually something that new. It has been in this industry for more than 50 years. First is actually what is learning we mean is, it is a systematic and deliberate approach to generating, capturing, sharing, analyzing, and applying information and knowledge. And one of the way of capturing learning is through monitoring and evaluation. You know, in the aid world, we have got 2 ways of program management. One, we call it predictive or plan-driven. The other one is called adaptive or change-driven. Just think about the situation in the project. When we design any project proposal, all the time, we think the project is just in a linear approach, meaning if I give A and B, then I will achieve C. But in fact, when we come to project implementation, situation is not always like this. There are lots of hiccups. There's lots of, it is just like your heartbeat rate, where when you start, implementing the project, lots of factors comes, lots of things, risk comes. So you cannot actually do this. You have to make some changes. And that is what we call is adaptive management, where you have to have the provision to make any changes if you have to, just to achieve the objectives. So what is adaptive management means? Not to change the objective, but change the pathways to achieve the objective. Now, as I said that this actually, this adaptive management or learning, it is, if you go for the historical perspective, you can see almost more than 50 years ago, all the donor agencies, implementing partners, they've started thinking how to introduce this learning into the project. The first thing is, during the 1990s, this results-based management approach has been in this industry. The donors are now asking for results. They are not just happy with output-based, these results. They said, no, we need to see impact and outcome-based, the results. We need to see the impact. We are not happy with only outcome or output, that how many numbers. Numbers is not enough. We need to see what are the changes it makes, right? Most of the United Nations had adopted this results-based management by 2000. And in 2005, through this, Paris Declaration about effectiveness, it has strengthened that slogan or that, appetite to the aid industry. It has got 5 pillars. Pillar 4 was result-based management. Pillar 5 was accountability. So how it is linked with the learning is one of the most important, determining factors, or you can say the learning is one of the most the successful factors for result-based management. And after this Paris Aid Declaration, then Accra Agenda for Action in 2008, it has got 4 principles. I will just give you an example of that one afterwards. So according to the literature review, it shows that actually the learning is not something new. Already it has been introduced in this aid world for a long time. At the same time, adaptive management has been just in place. So you can see that from 2020 to 2022, this appetite is growing in the aid industry, but there are more to do. If I go to the donor initiatives, I'm just giving on the example of for donors when they just adopted this learning to adaptive management. First, the Foreign and Commonwealth and Development Office, which is before it was, we used to call it DFID. They introduced it in 2000, but in a different name. USAID has introduced it in 2010, but in 2017, they had a special program called CLA, Collaborating, Learning, and Adapting. Then if you go to this OSAID, they've introduced it in 2015. And with cash relief, we introduced it in 2019. So I can say that actually, after just only 4 years of establishment of the center, we have introduced this collaborating and learning approach in our program, okay? Now, if I go to this research objective, although this learning and adaptive programming has been in the field, in this industry for more than 50 years, but there was no systematic research on learning to adaptive. There are many reasons. Actually, I don't have the time, otherwise I could just explain that one. The 2 objectives that we have here is, one of the way of learning to adaptive programming is through monitoring, evaluation, and learning system. So we just actually try to assess the impact of our M&E system towards learning to adaptive program management. And the second thing is to recommend strategies to promote learning and adaptive programming if there is any. I'm just going to give a bit more details here afterwards. Actually, although all the departments, it is a collective effort, it is not only monitoring evaluation departments. So within the case relief, we always work in a coordinated way. Other departments are also contributing to this collaborating and learning, but here we are just only focusing on MEL departments, these achievements. We have developed lots of policies, processes, tools, techniques, and templates for monitoring and evaluation. And we have introduced those things in 37 projects with, and then we just measure the effectiveness of this, how this, our M&E system, policies, process, and toolkits help for adaptive learning. Again, our research questions. What we did is, as I said, this Accra Agenda for Action, it has got 4 principles: ownership, inclusive partnership, delivering results, and capacity building. So we wanted to see that our ML system, how far it helped achieve these 4 principles. We just divided our whole research topic under 5 questions. First question is, when should learning process begin? How can donor help implementing partners in learning lessons and adaptive management? What type of M&E process can facilitate learning and adaptive management? How can donor help implementing partners build their capacity towards learning? And how and why to document lessons learned? Already it was discussed that whether there is any lessons learned or not. And you also mentioned, but we have been doing it since like 20 years. Now, first question is, when should the learning process begin? There is a controversy, I should say, between the researchers. Someone said it should be done at the end of the project. Someone said no, it should be done throughout the project cycle. Thank you, Dr. Khalid, you have shown this project cycle. This is what actually I'm just referring to. So, but we also believe that learning, we shouldn't wait for the project to finish. We should start it at the beginning of the project and then throughout. So what KS-RIHF has done to introduce this learning? Now, in 2020, KS-RIHF has introduced a new project proposal template where the implementing partners, when they submit the research project proposal, they have to mention learning at 2 stages. The first one is, they have to mention actually how they capture learning from other projects or from their experience in this project, how this learning has been brought first. And second thing is, during the project implementation, how they are going to just capture this learning, how they're going to use this learning, how they're going to disseminate this learning with the objective of aid effectiveness. So this is learning process now. All implementing partners must include it at the beginning when they're just designing the project proposal. This first. And second thing is also the reporting template. We have got a specific section in all our reporting template where the implementing partners has to mention that actually what are the learnings for that particular period when they're just reporting to us. So learning is already embedded in our system. The findings now, what we found is applying lessons learned throughout the project cycle enabled organization to make informed decisions, improve practice, improve the capacity of individuals, enhance organizational learning, and increase efficiency and effectiveness. Second is reflecting on lessons learned at different phases of project cycle, ensured project success by improving the overall quality of the project management process and project deliverables based on experience. Our second question, how can donor help implementing partners in learning lessons and adaptive management? The one of the best way is, according to the literature also, sharing the lessons learned with the implementing partners at different stages. What we do, last year, in 2020, we received 104 project proposals. As soon as we receive it, we give technical and comments to the implementing partners if they need to change anything there. And so once we just give this, this feedback to the implementing partners, either they accept our comments or if they need further discussion, then we also have some meetings with them before the project proposal is finalized. So this is just like a participatory approach. We try to give all sort of support to our implementing partners so that they have the chance to improve it before the project proposal is finalized. And last year we have like 30 meetings with our implementing partners before the project proposal is approved. So this is how actually we institutionalize learning in our process. And after signing the contract, again we have another meeting where we just discuss all the learning processes during the project implementation, how they're going to implement it. And also we have some findings that actually help IPs to adopt a holistic results approach, oriented approach to project management and learning. And this approach and tools are recognized as best practices for double loop learning necessary for adaptive decision making and implementation, and single loop feedback to meet reporting requirements of donors. Number 4 question, what type of M&E process? We are always adopting a participatory M&E process where you had mentioned about this involving the beneficiaries, involving the implementing partners. We always do that participatory monitoring and evaluation. How we do it? At the beginning, we prepare our terms of references, and then we share it with the implementing partners before we go, at least 1 month before, so that they know actually what we are going to assess. It is very open process. They can now assess their own system, and they can give us, they can prepare with their findings. The second thing what we do is, also we have a lot of like real-time evaluation, especially for short-term projects, where we go, we identify the issues, we give them on the spot some solutions, and they change it. And third thing is, as soon as we finish any assignment, M&E assignment, we prepare after action plan. If there is any areas where they need improvement, we agree with the implementing partners, we give this presentation, we share it with them, we develop after action plan, and they have to follow it. Right? So you can see that how this learning is embedded into the system, and we found a lot of advantages of this one, of just sharing this information with them, like sharing QR help them to assess themselves before we go to the project. The real-time evaluation helps to give real-time feedback, and after action plan helps them to accommodate the changes required. Then capacity building also we do. After we discover any issues during this implementation and during our monitoring evaluation, if we find that the implementing partner needs capacity, then we make tailor-made training, and we provide this training at that time, just before we leave the country, so that we are all on the same page. My time is short, and how we document the lessons learned, you already mentioned about this lessons learned. Look, we are already have got this two ways. One is we always prepare our annual performance report, and all the lessons learned are included there, and it goes to our senior management. Second thing is we also develop after action, we call it learning register. I think you termed it a different one, but we have already had that one, and this is what we use throughout the event. We share it with our implementing partners, we share it with our project management team, so that when they just implement the project, assess the project proposal for funding, they can get some ideas about if they have to introduce something new or not. In conclusion, we have got 5 things. We found that an easy-to-use MEL system is crucial for learning to adaptive programming. Second thing is supportive organizational structure and process are needed. The lessons learning process should be planned at the project design, not to wait until the end. Continuous reflection and analysis organization can learn from their own success and failure. And for adaptive management, project leadership team on the ground must have some decision-making authority, and the implementation plan must be flexible to respond to changing conditions. This is what actually we found. Before I go to the conclusion, I just want to share with you 2 quotes from Einstein. He said, anyone who has never made a mistake has never tried anything new. Anyone who has never made a mistake has never learned and never developed. Our conclusion, our recommendations now based on this are 3. Actually, we institutionalize this learning within case relief, but we want to expand it globally. And how we can do this? The first thing is we are proposing an innovative hub can be established to promote learning to adaptive programming and management in the humanitarian sector. Second thing is just like for research and documentation more. As you mentioned that we need to do a lot of research with the university, we need to involve the universities and other actors to come forward. And number 3 is common platform of knowledge management. You also mentioned about this knowledge management. So this is very much important. The second and third one can be done through the first innovation hub. So we are now, this is our message to the implementing partners. Don't be afraid to start over again. This time you are not starting from scratch. You are starting from experience. Thank you very much.
I think what I like, and I think I learned, I'm sure you all learned, the idea when he brings the results, he reminds you with the question again. That is very good. Although we say this to our students, but we hardly remember to do it. It's very good. You remind you with the question and what exactly the results and so on. I think one thing to add, I'm not on time, but in our book, I hope I can find it with the driver. I will give it to the center about knowledge management. We have a model called Smart KM. We say, one of the things we say, again, just to add to the 2 quotation you brought about mistakes, make new mistake, but don't repeat the old mistakes. Acceptable. Keep making mistakes, but they should be new. So you cannot do a new one. It's really good, and I think I like the conclusion. I think the recommendation following very well what I said earlier. We have to establish a knowledge management framework. So we go to our last, not least. I think we're doing well on the time. We're going to have our final paper for this first part of the session. Work done on future direction of King Salman Center for Humanitarian Relief. I really congratulate Dr. Iman and Lugain for putting this sequence is very good. So these papers are really coming after each other, very good. So this one we're going to look at also King Salman Center for Humanitarian Relief in Yemen as an example, but work done on future direction during the COVID-19 crisis. And this is going to be delivered by Professor Amin Bawazir. He is currently the chairman of Community Medicine Unit at the College of International Humanitarian, of College of Medicine and Ma'arifa University. Professor Bawazir contributed to the International Humanitarian Mission in Pakistan during the earthquake. His publications on many themes were highly cited. بس يكفي لأنك نديك كمان حاجة الأخير. Dr. Bawazir research focuses mainly on cancer, non-communicable disease, hepatitis, and family planning program. The floor is yours, Professor.
بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين. So I will not touch it. Thank you very much, first of all, to give me this honor of presenting my work. The work started that with the very important question. We are providing aids to certain countries or certain community. So to what extent these aids have impact on the community in particular. 2020, an enormous number of patients, many of whom were hospitalized for a long time, leading to chronic exposure, thereby increasing their risk to contaminating or to contracting the disease. This is particularly regarding the healthcare workers in two governments governorates in Yemen, which is called Al-Dali' and Lahj. Huge burden to the healthcare workers is clearly known that due to their contact to the patient, and so King Salman humanitarian relief is really, the foremost organization providing humanitarian assistance to Yemen as example, for example, and as well as to other countries. The relief efforts are directed toward the public and healthcare workers in hospitals who are working in combating COVID-19. World Health Organization recommended what it called a program infection prevention control protocol in order to reduce the infection, particularly among the healthcare workers, and to protect them. So to what extent the workers in these hospitals, in these governorates, were really, adopted these, what it called guidelines in order to reduce the infection. The purpose of our work is that to review the humanitarian work done by the King Salman Relief to support the healthcare worker sectors in Yemen during the COVID crisis. On the other hand, an assessment of the seroprevalence rate of anti-SARS-2, COVID-2 antibodies among healthcare workers as impact, as just only as we can say, to reflect to what extent this aid really is it just only aids or needs other issue also to complete. So data were collected from the King Salman Relief humanitarian effort as medical aids to the healthcare sectors in Yemen over the period of 4 years. Sorry, it is 3 years, but started till the 2023 also, was analyzed. A cross-sectional survey was also conducted among 404 healthcare workers in Lahj and Abdali hospitals, June 2020 to September 2022. So a self-administrative questionnaire was distributed to all voluntary healthcare workers, as well as a blood test were collected in order to check the level of antibodies that belongs to the COVID-19. The impact of the aid efforts on the seroprevalence rate is assessed and correlated, and the lessons which are learned on what needs to be done improve the utilization of these efforts and are also discussed. So that means it is not only to provide help or aids or donating, but what is the outcome that can be obtained. So we know that the King Salman Relief implemented about 764 projects with a huge amount of money with a cooperation with the Yemeni Ministry of Public Health and Population during the last 5 years. It covers more than 12 governorates of Yemen, which include projects to support vaccination program. The first and second batch of urgent measures were initiated in May 2020. That means immediately after the COVID-19 started. The first case in Yemen was discovered in April 2020. So, supported and improved the capabilities of the Yemeni Minister of Health Population in order to counter the outbreak of SARS. Further, the provision of personal protection equipment is also added, and other protective gear for healthcare workers. For example, also additional PCR devices and accessories, medical and laboratory devices and equipment also provided in order to combat the COVID-19. PCR testing machines, kits also given. Personal protective PPE were given in order to protect particularly the healthcare workers in the hospitals. Medical aids including healthcare items, protective masks, healthcare staff, ICU ventilators, N95 protective masks, gloves, infusion, syringes, bombs, disinfectant, sterilization. All these issues were provided to the Ministry of Health in Yemen. More than that, the examination beds, regular and portable ventilators, thermometers, electronic blood pressure, blood glucose meters, everything, as well as 81 ambulances and 6 mobile clinics. So these are really a huge amount of aids that given or provided to the Ministry of Health in order just only with the direction to control the COVID-19. This is the summary of these, what called the aids that provided. So, on the other hand, a seroprevalence test were done or conducted among the healthcare workers in the 2 governorates, which is Lahj and Abdali. So the population were the healthcare workers around 404, and they are around the age of 33. Males were higher or more than females. Also nurses reach about 51% of the participants. Unfortunately, the seroprevalence rate among these healthcare workers were reached up to 94.3%. What it means that? So if we are providing all these, material and donation, and at the same time, the rate of infection, that means that it's reflecting the rate of infection is high. So probably there is something or some gaps we should, fill within when we're providing the materials or the donation, we have also to do in order to avoid this. So this is also showing that what are the different, symptoms that appear among these healthcare workers. Never mind. So we can say that association between adherence of the WHO recommended standard, for example, the infection prevention control protocol, and to what extent it is, adhere among these care workers. So we observe that poor adherence to this, and particularly around 52%, low adherence to the use of personal protective equipment, because we also gave some questions regarding to what extent they use these protective measures. Most of the healthcare workers, around 82%, indicate unavailability or insufficient quantity of the PPE. 2/3 of the healthcare workers did not receive any training, and this is very important in the application of the IPC. So it means that however we are, presenting or giving the aids, we have also, parallelly, we have to do something else. For example, training the people, making them more adherence to the IPC, PPE use, and all others. The high seroprevalence in Yemen could be due to inadequate training, where 38% of the healthcare workers receive the IPC, only 38, and decreasing the compliance in the implementation of the IPC, which is very important. So all these conducts illustrate that any intervention to reduce the outbreak of disease cannot be fulfilled in an environment where there is a laxity in the implementation and compliance of the IPC protocol, particularly among the healthcare workers. Another reason may be due to the natural infection, this increase in the rate, rather than due to the vaccination, because also the vaccines is very low. The healthcare workers, very low segment of them, they receive the vaccine. It is different from other countries. Antibody detected in this study don't confer immunity per se, but reflect previous exposure to the infection, which subsequently leads to immunity. There is some strength of this type of work that the King Salman Relief, a humanitarian assistance organization, has implemented more than 764 programs and projects in Yemen during the past 5 years to alleviate the suffering of the people of Yemen during the ongoing political conflict. Moreover, the relief measures increased tremendously during the COVID-19 pandemic to alleviate the suffering of the people, as well as it provided a much-needed lifeline to the healthcare system of Yemen. To the best of our knowledge, our studies is the first study that assesses the impact of the humanitarian assistance provided by the King Salman Relief in Yemen during the COVID-19 crisis, with the level of seroprevalence of COVID-19 among healthcare workers in these two governorates. Also, ours is the first study documented the seroprevalence of antibodies after the 5th waves of the global COVID-19 wave. Only in 2 governorates in Yemen. This is one of the limitations, that we cannot generalize all our work, because only we used 2 governorates from 21 or 22 governorates. Qualitative serological tests were conducted in our study rather than quantitative. Recall bias also, those, for example, when we asked them about the use of the IPC or use of the PPE, as well as the signs symptom that they have. In conclusion, we can say that in spite of the huge medical aids supplied by the King Salman Relief, the seroprevalence of the COVID-19 is very high among the healthcare workers in the hospital in these 2 governorates. Underutilization of the AIDS effort may be one of the reasons for such high rate of seropositivity. Inadequate implementation of the IPC protocol and control measures, and decrease the uptake of the vaccines, because they did not, most of them, they did not receive vaccine. Vaccination and reinforcement of IPC measures and training activity are important for importing knowledge, and appropriate implementation should be, encouraged. Lesson learned from the correlation of the seroprevalence with the aid efforts can be used as a guideline for further work in anywhere. Thank you very much for that.
Thank you very much, Professor. Can I ask you, the speakers, Professor Wafa, Dr. Maha, Professor Khalid, Professor Duta, and to join them here, we have 3 minutes. We will use them effectively. If you have any question for any of the speakers, we will give you the opportunity. But yeah, can you all, I think it should take you, 6 of you, right? Now, if you can give them mic, yes, thank you very much. Maybe I start because you all mentioned about lessons learned. Can I ask you in 30 seconds, starting from Dr. Maha, because you're the first to speak, what lessons did you learn from these other researchers? I want each one of you to reflect. Just give me one thing you learned from the other work you have seen in this session. Maybe, what have you learned anything from those other researchers done? Any one of them?
Actually, seeing the perspective of other specialization is really interesting. So we saw medical background, even transportation, which is under the civil engineering also. So it's really important to collect the data and analyze it and learn from it for any upcoming disasters that might happen.
Excellent, thank you. And Professor Khalid and Duta, can you share any one learning lessons?
Yeah, I think one of the learned lessons that there is a huge complexity of the humanitarian work. And we've seen different partners and different parties. They have to come together and share the experience, work together to have a real impact on this arena.
Okay, thank you very much. And Mustafa?
Thank you. I think actually, the first thing actually I think that this technology can be used, this advanced technology can be used in in this emergency situation, right? But second thing is, I can see there are some research gaps. The presentation said that there is nothing this and that, but in fact, it is already there and for long, 20, 30 years back. So we need some coordination.
Okay. So, Professor Duta?
Thank you. So, as I saw the various presentation, that should be the a framework to be implement the resources that we have. And Dr. Mustafa also tell about the adaptive programming that can be used for the implementations about the framework.
Okay, and Professor?
Thank you very much. First of all, really, I appreciate that the conclusion that raised by Dr. Alim Billah, which is really there a need of collaboration and cooperation between the universities as well as with the King Salman Relief Center. Very important in order really to enhance the level of the research that we need either before and thank you.
Thank you. You can pass it back to Professor Wafa. Okay, use it, please.
So I think there's been lots of knowledge and approaches and the evidence of a lot of work. I think what we need is clear vision and clear thinking and planning and integration. I think lots of efforts, if integrated at all levels, we can do much better contribution to humanitarian aids.
So thank you very much. I put down 6 very good points. I only have time for 1 or 2 questions, but make your question very clear, and if it is for a specific person, yes, and can you introduce yourself and ask your question, please? Yes, go ahead. Just make it short and sharp, okay? Shall I give him this mic? There is a mic there, she said. Yes, he's passing it there. Here, you can just take it. Yeah, just give it to him. Thank you. Thank you very much.
No, thank you very much. It is really very rich discussion. Thanks for that. My question is, more, I think, specific to maybe Dr. Mustafa on the Research and Innovation Hub. You are saying that Case Relief's one of the recommendations is to do a innovation hub and how it would then help. So my question would be, where do you think Case Relief could possibly partner with international agencies or UN in the research or, let's say, innovation hub? Do you have plans, and how would you do that? Anyway, I'm Nafis Khan. I'm a senior program officer from FAO headquarters in Rome. Thank you.
Thank you, Dr. Khan. Shall I?
Yeah,
Shall I? Oh, okay. Yeah, thank you. Actually, this is just now another question. We just raised this issue that we need to have some innovation hub. And the reason for this innovation hub is we already institutionalize our learning within the organization, but I think it is not enough. We need to do it with the partnership, in partnership with other agencies. Now probably this could be the next question, how we can promote it, who will lead this process. This is something needs to be discussed at our management level, but we agreed that actually this is something we need to do, right? And like the 3 recommendations are all linked. If we can go for an innovation hub, which can generate lots of, this knowledge and just some packages and whatever it is, right? And identify the research gap, everything. So we need an innovation hub, no doubt about this. We need to discuss it at our headquarters, by our senior management level. They will decide how to do it, but definitely it has to be done through our partners. And it has to be done through the, some of the, maybe if you can even take the lead, we don't know, but it has to come. I think after this session, after this forum, maybe it will be discussed at our management level and they will decide.
Thank you very much.
Thank
One
you.
last final question. Yes. Yeah, you give it to you. Yeah.
Assalamu alaikum. Thank you so much for this opportunity, and I would like to thank all the presenters for their good presentation. And my question is specifically to Dr. Khalid and Dr. Ashit. What is your future for this project, and what is the impact you are vision for that and you are looking for? And if there is any opportunities to matching other disciplines with this project to look for that impact.
Thank you very much. Professor Khalid or Professor Ashit?
I will take the first part of it, then Prof. Ashit will elaborate on that one. As you have seen, that our research was in a small, controlled environment and a simulated environment in small instances. If we want to extrapolate that one to a larger real-life situation, then we have to have real data from the ground. It might work. But we have to test it. The design was built to improve, continuously improve. So probably in collaboration with King Salman, we can start to scale up the analysis, having the right computing capabilities to predict the right modeling for optimizing the allocation of resource and transportation. Professor.
Thank you, Dr. Khalid. You elaborate about the project. Dr. Najik, our project is very interesting that we have to find out the 2 things in that. In any disaster management, we have a problem with the route and the allocations. The resource allocation is more important, and also to find out the optimal path through which they will be go. Because in the disaster, all the route is damaged, maybe trains, maybe it is the weather condition is very bad. So our proposed framework will be help them to find out the proper allocations of the resources and also the optimal path. It is a 2-man in our framework. We'll try to implement, already this project is implemented with the data, with a few amount of the data. If we have a large amount of the data, it is also implemented in the high end. Also, our proposed framework will be support the Turkey disaster management now, like the earthquake. If you have the GPS data about that, our proposed framework will be support the Turkey or Syria disaster management on the real time. Thank you.
Thank you very much. I know you want to do it very quickly, please. Because I don't want to...
I would like to add a comment. Unfortunately, the humanitarian work is far behind in the area of research and research work. And I think the engagement of universities probably will fill that gap quickly. All sciences now is very much based on research, and evidence-based practices is always there and developed and further developed. And the humanitarian work, as me being working for 20 years, unfortunately we are lagged behind.
And can you introduce yourself?
I'm Dr. Samer Al-Jtaili. I'm the consultant of Supervisor General Dr. Al-Rabia, also Director of Financial Resources and Development and spokesperson for the KS Relief Center. I'm a professor in King Saud University previously, but now I work in humanitarian work.
Thank you very much. Thank you.
So what I'd like to add to is, I would say that there is responsibility for the academicians to have their role and job to be done in the humanitarian work. As KS Relief, we will open the doors, all the doors, for you to help us. I think it is the duty of us in Saudi Arabia not only to fund the humanitarian work. We are number one funder for the on the global for the humanitarian work, but it is our duty to further improve our work, that fund is effectively used and cost effectively used to reach the beneficiaries. And I think the research work is I would conclude with this, the research work is the area where we need, and that going to make a difference for us in our practices and further develop our work in order to create an impact in the needy life and needy world. Thank you very much.
Thank you very much. This is interestingly, this is the conclusion I'm going to say, and I said it yesterday. I hope the moderator yesterday mentioned it. I mentioned about research in humanitarian, the research gaps. These gaps are created because the humanitarian practitioners are the ones who are in the field, supposed to be collecting the data, but they are very busy with helping people. So that's one of the problems. It's not their fault, but because they are not academicians having the time and the focus to collect data. This is the people which we should really work with them, coordinating with them, strengthening their capabilities. That's number one. Number two, what I said yesterday is that universities should find a way to work with the humanitarian practitioners, because this is part of our impact and responsibility towards the community. And number three, I can just read from here, research gap is mentioned twice. We should enhance research. I agree with you 100%. At universities across the whole world, humanitarian research is not really receiving that biggest attention. There is not much courses, not much research. That's documented. So the conclusion, we should do much more in research. We should really collaborate, and we should really learn lessons. I agree totally with the word from Professor Khalid, the complexity. This is a very complex project. Even at Sussex, we used to teach project management, and we teach complex project management, two different courses. This is all, I think they all, like what's happening in Turkey now, in Syria, is a complex project. It's not a normal project, start to finish. And project sharing, knowledge sharing is all important. I am really happy that the center leaders now here, they're all saying the same. Knowledge management is the key. The United Nations said without knowledge management, there is no sustainable development. So I think you should conquer that. And the final word, Bill Gates said two months ago, without innovation, sustainable development will not be achieved. So I think we have heard all of this. I would like you to share with me something. But before we go, all this sharing, we established and launched last 3 months, in London, something called SDGs universities, particularly to bring people together, to bring King Salman Research Center with Harvard, with Sussex, and so on. Please Google it. It's very simple. SDGsuniversities.org. It launched in London at the University of London last October. We would like you all to join. Exactly, this is one of the things which we'll do. I would like you to share a very strong appreciation to these people for two reasons. Number one, two reasons. Number one, they have tremendously worked very hard on their research. They produce excellent work. So we should thank them for that, number one. Number two, which is very unusual, I have been in all over the world, very unusual in academic session, no one of these speakers exceeded his or her time. So we should congratulate them really.